Welcome back to the program. Busy program here on a Wednesday, which means we are going to have a visit from our favorite dentist in the world. Oh, it's time for Great Smiles. Dr. Steffany is here with us, and what are we chatting about here this morning?
We're chatting about a lot of good stuff this morning.
For example?
Well, Jackie was going to start.
I was going to say, so we have a couple things with the governor taking upon himself this week to help Iowa be a healthier state. We're always trying to work on that.
Yes.
So yesterday he declared that if we're going to drink soda, we should drink diet soda or maybe take water as an alternative, which kind of works in the sugar factor that we're always talking about. But more importantly, this Friday, he's making an announcement as a new Healthiest State Initiative campaign called Get Your Bib On, saying that it's important to go to your dentist and for oral health, for Care for Iowans, and to sign a proclamation declaring June as Get Your Bib On month, saying people need to head to the dentist.
A lot of people forget that there's a big, giant correlation between your overall health and your oral health, so your dental health. And a lot of people used to think it was totally separate. Well, my teeth can be a mess and the rest of my body can be healthy, and that's not really the case. So now we know, and there's so much research out there that diabetes is tied to problems in the mouth, and vice versa. Your diabetes is worse if your mouth is worse, and your mouth is worse if your diabetes is worse.
So your window, your mouth is like the window to your health.
It's totally, think about it. Everything that we take into our body goes in through the mouth.
True.
Hopefully.
And I've heard the same about your heart as well.
The heart is a major thing. So the one other place that the bacteria in the plaques in the arteries lives is in the mouth. That's it. So it goes into our system through the mouth, and then it gets stuck in those plaques in the arteries, and then that's where it lives. So I mean, that's very, very important. So if you have a very clean, healthy mouth, which is not possible unless you visit your dentist, so I'm glad the governor said it, and it's just not. I mean, a lot of people think they do a really, really good job, but there are places that we all miss. I mean, every time I get my teeth cleaned, I have things too. So it's I mean, and I think I'm fairly reasonably competent at cleaning my own teeth.
Where do you where does a dentist get yelled at for not cleaning enough? That's what I want to know.
I don't really get yelled at because they work for me.
Right. or spoken to.
So almost everybody builds up behind the lower front teeth.
Here.
Almost everybody. I mean, we spend a lot of time there. So if people are going to lose teeth, a lot of times that's one of the first places that they lose teeth, because once you build up that plaque around and tartar around those teeth, then a lot of times people lose the bone, and that has very, very small roots around those teeth. And so if you lose the bone around those teeth, they get loose. And
it's hard to imagine because that's where your tongue is playing a lot.
It is. I know. Isn't the tongue a little curious creature? Yeah. You can't have anything change in your mouth without your tongue just like.
What's that?
Yeah, exactly. Yeah, you're doing it right now.
Well, yeah, because you just gave me an implant not long ago, and that was the weirdest thing for about a week.
It's a little weird, yeah.
But it's great.
And then your tongue redirects, and it finds something else to play with.
Right.
But it's interesting when we're talking about Iowa trying to be the healthiest state in the nation. We think of what we do eat. We think of exercise and things like that, but we don't necessarily think of dental health. But apparently, it's enough where our governor is like, we need to make this a focus for this specific month.
Yes,
and as well as year-round.
I think the biggest issue with the way that we live today in our culture is that we don't think. We rush through our days, we rush through our weeks, or we savor our weekends, and then we don't stop to really think. How am I living my life? What am I doing? What could I do better? How could I be healthier? Should I really be drinking the soda at all, or is water just really the better choice? We don't buy it, and if you don't bring it into your home, your kids can't have it, and that kind of thing. So I mean, it's just those choices, and we all make choices, even though we think that we're not. I think that we think that we're on this path, and well, that's just how we do it, or that's just how it is. But we all are making choices, and I think having a healthy mouth is definitely a choice. And it is. We've talked about this several times, but it is way, way, way more expensive. Way more expensive to have work done versus preventive maintenance done. So I mean, have the preventive visits, have the the cleanings and the checkups and all that kind of thing. Find things when they're small, just like we do with cancers and just like we do with diabetes. Or if somebody's pre-diabetic, they take steps to not become diabetic, because you lose toes when you're diabetic, and you have all sorts of issues. It's not
you're
not
be
just
losing
being
teeth. If
exactly, you lose teeth, right? So
now something as simple as brushing your teeth.
Yes.
Some people might say, once. Yeah, I do it almost You need to do it.
Yeah. Well, having a partner helps that too, right? You know what I mean? So it's nice to brush your teeth when you're with somebody else and you kind of give them the courtesy.
Seriously, how long do you say we should brush your teeth? Because back when they first started, you had a little handheld brush and they said 2 minutes, sing a birthday song. Now they have the ones that were mechanical. Now they have the ultrasonic ones.
Yeah.
Can you do this in about 15 seconds? Or
It's one of the reasons why I like the ultrasonic ones is that if you spend 2 minutes in the morning and 2 minutes at night, you will have virtually no problems with your teeth unless you're pouring in sugar the rest of the time, or you're smoking a lot, or you are diabetic or something like that. A lot of people do need to brush in the middle of the day. They really need to have something extra. But the most important thing is that you're really spending the time. I mean, 2 minutes. Everybody has 2 minutes in the morning. I mean, even when I had 4 little kids, I had 2 minutes in the morning and I had 2 minutes at night. And most people are. I mean, you have the excuse that you're too tired at night, that you don't have the time or whatever. But everybody has the time. I know. It's hard for me because I know how easy it is if you just take a few minutes. And I know how well people do and how healthy their teeth stay if they just take a few minutes.
And we haven't mentioned.
I've seen the proof, right, all the time.
Flossing.
Flossing is really good for you. Flossing is one of the major things that you can do to help your heart. Remember a few years back when they had the Real Age guy, what's his name? He worked with Dr. Oz. They had the Real Age test.
Oh, you try and figure out.
Yeah. So brushing and flossing, would decrease your real age. So if you're 40-something, you'd be late 30s because your real age was less if you brushed every day and you flossed. And so you could literally decrease your age by several years because it prolongs your life. You'll live a lot longer. So, I mean, they say you can add 3 years to your life by flossing and at least a couple years by brushing well.
But flossing was such a pain because you had to take it out of that little thing and then wrap it around your hand and then stick it in your mouth, and nobody knew how to do it until they came out with
I know.
these.
That was very, very magical.
See, those drive me nuts. I'm still
I
old-fashioned.
love these.
Where's the rabbit?
I carry these with me all the time.
They're great, aren't they?
They really are, and you get used to using them.
Yeah. You guys have no secrets, do you? Everybody knows everything.
But it's really
4 hours a day together.
Speaking of that, Lou found a story yesterday on social media talking about a guy promoting that you should take out your own wisdom teeth.
No, I asked.
I don't think he was promoting that you should do it.
I asked Dr. Steffany if she saw it. If you want, we were going to show it. And I said, you know something?
No.
Even for us, it was a little too gross. The guy pulled out his own wisdom tooth.
Yeah, he was a dentist.
Yeah, he was a
dentist.
And
he said not to do it
He used
at
a
home.
mirror and a pair of channel locks or something and pulled out his own wisdom tooth.
Yeah, it went fairly viral, and along with the whole thing, it was very much about please do not do this at home. This is not something.
We didn't show it here, but you did see it.
Yeah, I'm never doing that. No way. Yeah, no.
Okay, so don't do that.
Go see Dr. Steffany. She'll take care of you.
Yeah.
She'll take out your wisdom.
Yeah, that guy, I mean, they might have patients leaving his practice like, I'm not sure I want to see somebody do that.
Yeah, but in case you're wondering where you guys are
It wasn't
located,
in Des Moines. No crazy people in Des Moines.
easy to get to. Off of 35, you head west a little bit?
Yeah, we're right on Jordan Creek Parkway, right off the interstate, and dmsmiles.com is the way most people find us.
Oh, I know what you're going to say.
I was going to say, and if people are looking for a great job opportunity.
Yes, we're kind of a fun place to work, so we're hiring. Yeah.
What are you looking for? Yeah, what are you?
We would train the right people. I mean, there's a lot of people come into meteorologists, on-air personalities, that kind of thing.
Yes.
Yeah, so, but yeah, people with experience or not either one. Yeah, dental assistants. Yeah. So we're growing, so we're adding people.
So just give you guys a call or check out your website, or how do people do that?
Yeah, just give us a call.
Okay.
And you attribute the majority of that growth to your appearances on this program, I imagine.
Absolutely.
Yes.
Yes.
All right.
Yes. Thank you very much.
All right. So as the governor says, get your bib on and go see your dentist.
All right, it's 9:21. We'll be right back. Watching Great Day Live on KCW.